Hey guys, are you ready to transform your mind so you can transform your life? Coach Mirna brings you one-on-one coaching and expert guests weekly to help you to grow. Because happiness is the progressive realization of a worthy goal.
Looking for personal growth? Let's do it. Isn't that the sweetest sound? That's the sound of another sale or another dollar hitting your Shopify e-commerce store. Nobody does selling better than Shopify. It's the home of the #1 checkout on the planet. Sign up for $1 per month trial period at shopify.com/transform, all lowercase. Welcome back to Transform Your Mind to Transform Your Life radio, podcast, and television show. I'm your host, Life Coach Mirna Young, and sitting in the guest chair today is Dr. Sarah Daccarett. Dr. Sarah and I are going to be talking on the topic progesterone, the silent hormone crisis wreaking havoc on your health. And we are going to be talking specifically about women and menopause, but I'm pretty sure that it can be perimenopausal, premenopause, post-menopause, women that, have hormonal issues. So stay tuned for some really good information on this episode today. Welcome, Dr. Sarah.
Thank you for having me, Mirna. I'm excited.
You're very welcome. You're very welcome. All right. So let me give you guys a brief introduction. Dr. Sarah Daccarett is a leading hormone specialist and anti-aging expert dedicated to empowering women to take control of their health and well-being. As the founder of Inner Balance, Dr. Daccarett has created a revolutionary solution for women seeking a convenient, effective, and personalized way to manage their hormones. Her mission is to break the silence surrounding hormonal issues and provide women with the knowledge and tools they need to thrive. Yes, we don't just want to survive, we want to thrive. All right, so women have, I think, two main hormones. At least that's what I think. But, one of the questions that you offered was, what is the primary hormone in women? And why is there so much confusion about this? Which leads me to believe that my assumptions are not correct. So, so let's answer that. Yes.
Let's dive in. I love that you start with this topic because there's a lot of misconception about what the main hormone is. I have heard from many experts that they believe testosterone is our main hormone because it is more abundant actually than estrogen, for example, sometimes in general, but reality is that progesterone is the most abundant throughout our entire life until it drops off. And we've always kind of ignored it. We think that it's only important for pregnancy, that it only protects the uterus. Even women that have their uterus removed later in life because of heavy bleeding or for whatever reason, and then they're not even offered progesterone. It's just only for the uterus, which is wild because it's really, really important. And we tend to discuss estrogen a lot. We discuss testosterone's role in libido. What about progesterone? It is 16 to 20 times higher, actually. It's magnitudes more abundant than estrogen in the body. And the reason why it's so important is that a lot of the symptoms that we attribute to perimenopause, all these symptoms that women have as they age are because of the dropping progesterone. It's both. Women need to understand that we are different species than men. We're more complicated than men. We're practically different species. Men only need testosterone, really. I mean, you can get testosterone, they do fine. Women really need to have all three of their hormones balanced in order for us to feel like ourselves. So progesterone needs to be highest and then estrogen and testosterone below that. But progesterone and testosterone balance one another. They literally do the opposite in the body. So estrogen is really stimulating. It can give women mental clarity and mood, and it stimulates the uterus and a baby to grow. You think about it, it's very stimulating. Progesterone dampens its effect. So you really need both in the body. They bind to the same receptor and they modulate and counteract one another. And this is how women work. It's pretty remarkable that we don't really talk about them together, though.
No, we don't. Everybody's talking about estrogen and estrogen positive cancer and estrogen hormone replacement. And you're right. They don't. The only time we, as women, have progesterone as our focus is, you're right, during pregnancy or during our monthly cycle. I think progesterone is high then or something like that. But I mentioned to you before we started the recording that I just had my hormone panel done, and I had almost zero progesterone. I had more estrogen than progesterone. And but yeah, so let's talk about that. So how you're saying that progesterone should be the most abundant one. So let's dive into that. What makes it drop, and why is it that the doctors only pay attention to estrogen?
Yeah, it's a great question. Let's start with like why it drops and when it drops. And I've seen in my practice over the years, and I think we're seeing it earlier and earlier, that women's hormones start to drop off at age 30. I mean, this is really like an 80% drop off. This is also why we have a harder time getting pregnant in our 30s. And certainly by the time we're 40 and above, most women aren't able to get pregnant, right? So women have under this misconception that, oh, I have a normal period. My period's normal. And even doctors will tell them this. I have a regular monthly cycle, therefore my hormones are fine. And this is really dangerous because the period, you can have a period and your hormones can be zero. They're not linked. And it's not linked to ovulation. Women can ovulate and not have a period, or they can not ovulate and still have a period, right? The period does not mean that you dropped an egg, and it does not mean that you're making hormones. And so this is kind of done disservice to women because it's such a visible thing. They can see it every month. And so we think we're okay because it's regular. But after the age of 30, we're not really making what we need to sustain us to have this really vital, to be, yeah, like this thriving that you mentioned earlier at the beginning, to have great skin and hair and prevent wrinkles and feel energetic and have great libido. And like really everything starts to get dry. If you notice, skin gets dry, hair gets dry, mouth gets dry, you get vaginal dryness, our eyes get dry. Even these hormones are extremely hydrating for life, things like that. So we notice that in our 30s, but we attribute it to something else. Oh, I'm tired because of the kids. I'm gaining weight because I'm not eating well enough. I need to do more. And even we're gaslighting ourselves. Like we talk about doctors gaslighting patients that they're normal, or that this is just the way it is, or you should feel like you have a painful period. It's just part of being a woman. And women will have that internalized that, and they think that's true. They think that, oh, I need to just put up with this because my mother did, or like it is just aging, and this is just, I'm getting muscle aches and joint pain now because I'm getting older. But the reality is that your hormones have dropped, and then we ignore it. They ignore it for too long until their period stops at age 55. And we see this 20-year period where women are suffering. Like they actually have a lot of anxiety, depression, insomnia, and they're trying to find solutions. They're taking herbs, they're putting creams all over their body, doing whatever they can to try to manage the weight. It's like a full-time job to not gain weight for them, and not realize they think it's something they're doing or not doing. And it's just biology. So the ovaries were never meant to work until the age of 90. Like we're living really long now, but our ancestors died in their 30s. And so this is why they just simply drop off, because our ovaries are not able to work as long as we're living.
Mm.
And so, you're asking like, I think your second question was, why don't doctors address it? And the point, doctors are not trained on hormone replacement therapy. Literally, there's zero training in medical school. So any hormone specialist like myself, we do it outside of residency. So even OB-GYNs, I think there's this misconception that OB-GYNs know about hormones. Just they know how to deliver babies and give pap smears and do surgery. They're surgeons.
Mm-hmm.
Like, and if you need help with heavy, like a specific thing or cancer screening or something like that, OB-GYNs can help you, but they're not trained for wellness, prevention, and hormone replacement therapy. This is like a longevity medicine. It's a field. It's an entirely different specialty field. I don't pretend to know OB-GYN, but yet OB-GYNs pretend to know hormones all the time. It's really weird. And so patients will go see their OB-GYN, and OB-GYNs will be like, that's dangerous. It causes cancer. You should do it. You're normal. And this is really bad. They pretend to know that they don't, but they don't know. Like, and so primary care physicians, they don't know. You have to go to hormone specialists. And even the hormone specialists still, there's a lot of variability the way we approach women's health in the US. So you really got to find the right hormone specialist too. Even on top of that, you got to go to specialist, and you got to just pay the money. And then you have to find the right one that will listen to you.
That's amazing. Well, I'm gonna head over there myself, because I read this book, Dr. Atia's book. It was a longevity book, and I think almost everybody on the planet has read that book by now. But he mentioned that we should get our hormone panel pulled. So I went to my regular doctor and I says, I want to get my hormone pen pulled. And he says, well, I can pull it, but I'm not able to read it. I don't understand what it says. So then I went to my OBGYN and I asked him to pull it. And he says, well, you're in menopause. So I know what I'm going to see when I pull it. What's the purpose? He says, I still want to pull it. So he pulled it. And then he said to me, well, I know what it's going to say, but because you're in menopause, right? And that's true. And that was the end of the conversation. So flipping back. So yes, obviously in menopause, you have a low estrogen, you have low progesterone. And I think one of the testosterone, mine is fine with that. But so let's say that you're in menopause. We're not perimenopausal now. You're in menopause and your hormones are low or non-existent. What is the workaround with that?
Yeah. So, a lot of doctors are like, I know what it's going to say, or I don't want to order it. And the labs really kind of are contributing to this misconception or problem. Like the lab community has not really done the research that they should. I mean, we have not really effectively established what's an optimal reference range. So, it's like, what if we have a 40-year-old woman? How do we diagnose perimenopause in her? Even though the laboratory testing, she may have like the point in time that you get a test on a 40-year-old, she could have normal estrogen levels. Like her estrogen could even be 1,000 and they'll tell her that she's high, but the rest of the month it's 0. So you just happen to catch like a really good result, like randomly. It's at one point in time. People need to realize that labs are only one point in time. Hormones fluctuate throughout the day.
Yeah.
The day, literally, you could get, and then they also have a 30% variability allowed by federal law. So like I could take one sample of blood and get a result and then do it again and get a different result, like with the same sample of blood that you took out of your body at the exact same time. So there's so much variability that it's not as helpful because it's like trying to hit a moving target, even with fancy metabolite urine testing, no matter what in company has like marketed, right? Okay, this is something that women need to understand, that the testing does not give you the answers that you're looking for. If you're going to order a test, like, so for you, it's clear you're menopausal because your period stopped, right? So we have a definition for you.
Mhm.
But what about that 20 years before menopause? How are women like able to get help? And that's really what is the question. And an FSH is the answer. So if women were to get an FSH from their doctor, it is the marker that's telling what the brain is thinking. Does the brain feel like there's enough hormone around? If the brain feels like there's not enough, the brain will signal to the ovary to make more. And how it signals it is it releases a substance called FSH.
Okay.
If it's high, then the brain is like, make more, make more, make more. It's telling the ovary it's struggling. And so, you're saying like your testosterone's normal, but that's because your adrenal glands are making it, right? But your ovaries are not working, and your FSH, nobody got it on you, I'm sure. But your FSH is really, really high to show that your brain is like, please make more hormone. Does that make sense? So this is a marker that's underutilized that women could really ask for and be empowered. And they don't really need it. Like if they were to start with us online, they don't need a lab test. Your symptoms are enough. We need to stop thinking about hormones as a treatment. It's not a treatment for menopause. It's not even a treatment for perimenopause. We need to look at it as, if you want to prevent disease, prevent aging, prevent symptoms, maintain your health for as long as possible through your 40s and 50s and beyond, and 60s and 70s, forever, then hormones are the foundation for that. It's not simply a treatment for a hot flash. And that's kind of a shift in the way that we need to think about hormones. Women need to think about it. They don't need to wait until their symptoms are so bad because they think it's a treatment. Oh, I'm just going to put it off a couple more years. I can put up with and just wait as long as possible. No, you need to start it as soon as you're having symptoms because your body decays. You know what I mean? Like it gets older, and we want to try to prevent and stop that aging. And even if you're in your 50s and 60s and want to start, you should, because there's still much, much to gain. There's still a lot of benefit.
During the summer, one of my favorite things to do is to sit outside in my lanai in the evening after a long day at work, sip a cold drink, and chat with my husband. So this week, I decided to refresh my outdoor space. So I headed to wayfair.com. I found a 5-piece patio set for under $400. Amazing. Summer's on the way, and there's no better place to go for outdoor furniture than Wayfair. Wayfair's huge selection of outdoor essentials will help make your outdoor space more comfortable, functional, and most importantly, more you. So whether you're looking for outdoor seating, outdoor dining, or even an outdoor hot tub, Wayfair has you covered, all at unbelievable prices. So don't wait until summer's in full swing. Get your outdoor space ready today so you can enjoy it all season long. Wayfair offers free and easy delivery, even on the big stuff. So no more huge delivery fees for patio furniture. Get the big stuff like patio sets, gazebos, hot tubs, outdoor dining sets, and more shipped free. Shop a huge selection of outdoor furniture online. This summer, get outside with Wayfair. Head to wayfair.com right now. That's WAYFAIR.com. Wayfair, every style, every home. I've been an entrepreneur since the early 90s, even winning the Entrepreneur of the Year award. But when I first thought of starting my business, I had the passion and the vision, but zero clue where to start when it came to selling online. This is where Shopify can help. Shopify helps you set up your digital storefront. Shopify is the commerce platform behind millions of businesses around the world and 10% of all e-commerce in the US. From household names like Mattel and Drew House to brands just getting started. Whether you're selling physical products, digital downloads, or services, Shopify has everything you need to launch, manage, and scale your business. Shopify is also packed with helpful AI tools that write product descriptions, page headlines, and even enhance your product photography. Get the word out like you have a marketing team behind you. Easily create email and social media campaigns wherever your customers are scrolling or strolling. And best yet, Shopify helps you transform your business with expertise in everything from managing inventory to processing returns. So, if you're ready to sell, you're ready to Shopify. Turn your big business idea into with Shopify on your side. Sign up for $1 per month trial period and start selling today at shopify.com/transform. Go to shopify.com/transform. Well, I think what's happened in the community is they're afraid of hormone replacement therapy. And I started mine and stopped because I had estrogen positive stage 0 breast cancer, and they stopped my hormone replacement therapy. And that was, 2 years after I became menopausal. So the conversation has been that hormone replacement therapy causes cancer. So women are afraid to take the therapy, even though I think the new conversation is that it's not true. So you want to address that?
Yeah, you're absolutely right. And this has been devastating. I mean, this study that was released, and would never have we ever based anything on medicine on one study. But for whatever reason, we completely changed the way we did hormone replacement therapy based on one poorly done study. Those authors retracted the results from the Women's Health Initiative. They originally reported the 40% increase in breast cancer. That was like not even true. They'd never even showed that. But you know what Mark Twain says, by the time a lie can travel halfway around the world before the truth can even put its shoes on. This is literally what happened. The media took it. There was a bunch of fear mongering. They blew up the story, twisted it a little bit. And it was never estrogen that caused breast cancer. That was never the results of that study. Progesterone, which is a fake hormone. It's what we found, as we find in birth control. It's a suppresses hormone production, has a slight increased risk, like very small. Like one extra woman got breast cancer and she didn't die from it. I mean, I'm just saying, like, this is like something that the risk is, there was no increased risk, even with the fake hormone. And so Now, this is like devastated generation, an entire generation of women who could have benefited from hormone replacement therapy. And now even younger women are still confused because they've heard your story. They hear the word estrogen and breast cancer in the same sentence. Like, and this is still going on. Estrogen positive breast cancer is actually means it's cancer, so it's not a good thing. But I'm just saying, I'm a pathologist, so I do know that like when you have the receptor present on the cell, on the cancer cell, it's a good thing because it means that it's still responding to the body's signals. It is still a normal type cancer cell. It's somewhat normal. Once it loses all that receptor signaling to the hormones, it becomes more malignant and more rogue. So when you lose that functionality, it's actually a more dangerous thing. But they make it sound like it's the estrogen's going to make it grow. This is not where we define estrogen positive and progesterone positive breast cancer cells. This just shows that the signal is still there, that the receptor is still there, but it's been twisted to show that. And so even oncologists believe that it's going to make your cancer grow. And then it's been extrapolated to every type of cancer. Estrogen makes it grow. And this isn't wild because there's no evidence for any of this. In fact, estrogen's been shown to prevent colon cancer. It's been shown to prevent ovarian cancer. And then now we think that we followed these women in this study for 18 years because we're like, does this really cause breast cancer? And then this was published 8 years ago, and we're still not. It should be on every news channel. It's not. So like the same megaphone that was like telling everybody that
Well, fear travels faster than good news. That's not the media. The media, that's what they promote. So fear is a it's a big thing. Nobody wants to hear. I'm not even sure you're right. I don't even think it's mega blasted. The only reason I know that is because I speak to professionals like you, and I know that, several people have come on and said that it's not true. And someone even told me personally that the span that I was taking the drugs could not have contributed to my stage 0 cancer because it takes longer to grow, or it takes longer to make an impact. But yeah, they pounced in it right away and said, yeah, you got to stop that right away. And of course I did. Um,
and then they put the fear into you to never do it again.
yes, exactly.
And we know what causes breast cancer. And it's like, and now we know that estrogen probably protects against it. Why are we telling you that this is protective?
Wow.
Yeah. And so it's even
like that.
It's more in fact, it will reduce your chances of dying from it by 49%. Like it's more protective than breastfeeding. We tell women to breastfeed to, protect themselves against breast cancer. Estrogen therapy is more protective. We're not telling women, we should be telling women that. And then, what really, like, I get it.
I heard that message.
Women they want to feel in control. They want to feel like, well, if I just avoid hormone replacement therapy, if I just avoid estrogen, then I won't get breast cancer. So they want to feel like they're in control. And I get that, like, desire. If you want to feel in control, like, I want to let all your listeners, if they want to feel in control of not getting breast cancer, you actually can. It is alcohol. Out for every drink you have increases your risk for breast cancer, like, exponentially with every drink you have. And then exercise. Like, if you don't exercise, you also increase your risk substantially. And then weight maintenance, like obesity, but it really is exercise, this lack of exercise, this sedentary, they say sitting's the new smoking. Like, this is what causes cancer. This is how you can have control, but avoiding hormone replacement therapy, that's not going to reduce your risk. You're just actually putting yourself at more risk. Like, why not, every woman over the age of 40 should consider it simply for prevention.
Wow. So I got to find myself a specialist. Where are you located?
So we're in 40 states. So we're all telemedicine. So it's online, trying to make it easy, like cut down this cake. Yeah, we follow you closely after you start. But we ship it to your house. You can get birth control online.
Okay, good.
For the birth
I'm going to be a client. I love this information. And by the way, thank you for that information just now about breast cancer, because, that's good to know. I knew about exercise, which is basically what my doctor, every time I go to see my OBGYN, he asks me about exercise, but never mentioned anything about drinking. And, I'm not sure about the weight gain, because yes, it goes together. You mentioned it in the beginning that, women at 35 start having the battle with the bulge, as I call it. And everything starts changing, their metabolism, and they start gaining weight. So, yeah, you're right. If that's the trigger for, breast cancer. And you mentioned about the drinking. I mean, those are two good things to know. But yeah, and exercise. I mean, I know it, but maybe our listeners don't know it. But yeah, I exercise 6 days a week, so I've taken care of that part of it. Wow. So so that was a great introduction to hormones and progesterone and breast cancer. So that was a really good conversation. So what are the signs that your progesterone is declining that women should be aware of? Because like you said, it's one of the ones that's not talked about a lot. So
Yeah, that's a good question. And I'd say the most common is mental. Like women feel like their body's been hijacked a little bit, or they don't like feel like themselves. And it's really this anxiety, irritability. I don't really like can't tolerate my husband breathing around me, and my kids are driving me crazy. And like normally I'm a very patient person, and there's this new movement in perimenopause and menopausal women that it's just because they don't have to put up with that anymore. But it's not, it's actually a hormone drop. And yeah, I agree, you don't have to put up with anybody from anything anymore. You know what I mean? So that we shouldn't tolerate. Yeah, but you should also feel like at peace and at calm and like a real centeredness about you. And women say that this is lost when their progesterone drops. You see heavy periods, but really it's the mental stuff that really bothers women. Sleep, and then but literally everything, your skin, your hair, progesterone's right, libido drops. And we give a lot of credit to, it's funny when you talk about libido because we give so much credit to testosterone. We're not tiny men. Like I am not a tiny man. And if you give me a little bit of testosterone, I do not necessarily want a libido like a teenage boy. And I have a lot of clients that will come to me and they're on testosterone and they're like, is this how men feel? This is awful. Like that they feel like having sex all the time. You know what I mean? And like, they're just like, is this really what it's like to be a man? And I'm like, yeah, I think they actually do have to feel like that all the time. This is what the testosterone does. And at first kind of nice because you get this like kind of rush of it kind of feels like a life, like you get the life back in you because you want to have sex. But, this is like more of a teenage boy sex drive, and you also get the acne with it. Like you have to push it the acne, and then when they start getting acne and this teenage boy libido, it will cause weight gain. Women think that testosterone will lose weight. This is something that they hear all the time. I tell you, testosterone makes women gain weight. It makes men gain weight. I'll put men on testosterone, they get bigger, right? If you think about it, they get
the muscle, right? Right.
Love
They
it.
get muscle.
Men,
What are
they
you
love
fat?
Exactly. Men love it. They're like, I've been trying to gain this weight for like my whole life, and now you finally got me to gain weight. And I'm like, you're serious? Like they love bulking up, right? That's men. If testosterone is an anabolic steroid, it makes you bigger. And so women, they think that it's going to make them lean and muscle. No, it's going to make you gain weight. And it does. They get cellulite, they gain weight, they get bloated, and they have a really bad outcome to this, like taking testosterone. If women understood that our libidos are open and receptive, and it's a different type of libido, but it takes time for them to gain it back. So if you're in your 50s and it's been a while for you for this, it can take 6 months for this to come back. It's not a like I feel like testosterone for women is a band-aid fix. If you want your real libido to come back, you want the sensitivity, the vaginal remodeling, the lubrication, the ease to orgasm, all the things, the being in the mood. Takes time, and it can take 6 months, but you're going to be much happier with your outcome, and your skin's going to look great too. Your skin's going to look good. And
all right. What are we taking for this? Progesterone? Is that what you're saying? Or balanced hormones, all of them?
like in reality, we need all of them. There's some receptors around the body for testosterone, but in reality, estrogen and progesterone play a huge role in libido in the brain. And women, like why do not we not give credit to our own hormones? Why are we giving all the sex drive credit to testosterone? That's my question. Like to women out there, why do they?
And you're very right. Doctors don't know this because none of my doctors have ever mentioned this to me. So, right. So I'm like listening here very intently. But the interesting thing is, I never got the irritability. So, but I've heard, in fact, that was again one of the stigmas that when you're in menopause, then you become a bitch. And so I never got that. So what is the reason for the brain fog? Because I have to work with that.
No, brain fog is both estrogen and progesterone. So you could have manifested more of like the brain foggy, but progesterone and estrogen raise dopamine. We need them to actually make dopamine and for it to function properly, as well as like norepinephrine. We need these neurochemicals to focus. And so like women will say that I started hormone replacement therapy and now my world is brighter. I can see better, I can smell better, I can focus, I have mental clarity, the brain fog, and it is a fogginess, right? It goes away. And they call it fatigue, but it is a fog. Like it's really this really fuzzy, awful feeling. And it's low dopamine. And yes, you can try to raise dopamine all the different ways. There's lots of different ways, but the most effective for women is estrogen. And so the brain, we talk about all the things that help with cognition, 80% of it is your hormones. And like you could take all the peptides and all the supplements that you want and all the coffee and exercise, but if you get your hormones up to a reasonable amount, your brain fog.
What is a reasonable amount? So for people that are listening, in menopause, or I don't know if it's different, what is the optimal amount for progesterone and estrogen and testosterone? If you're looking at it on your lab results.
So I think it's inappropriate. It's not personalized. I want women to know.
Okay.
It's not personalized if a doctor is looking at your lab test and forcing you into a reference range. How is that personalized? Like if women were like, oh, I want you to get labs and then adjust it to me, like adjust the dose for me. But it's like, actually, I'm going to adjust the dose and then force you into a reference range that's never been established. There are 5 papers in the entire world on progesterone and optimal reference ranges. It's literally not been established. Estrogen, those reference ranges of 400, there's like a number 400 that's the upper limit based on 49 women only. 49 women and 100 men. There were 100 men in your study that showed that like your reference range should be, it's ridiculous. So why, like you're asking, and then now you come to a doctor and now you say you want to be in a certain range on the lab. That's not personalized medicine. The only way to personalize it is to get on a starting dose, see how your body does, and your body will tell you, is this enough or not? And your brain will tell you with you, right? So your FSH will tell you if it's too much or not. Okay. And so if you're suppressing brain signaling to the ovary, then you're taking too much. And that's really the best way to know. And your dose is going to be different than mine or whatever, but the starting dose can all be the same. Like you can start somewhere. And if women knew like, what is the right amount? Well, we know that certain levels can get rid of hot flashes, and all the current stuff like patches and pills and like low dose vaginal creams, they only treat symptoms. They're only treating one symptom at a time. Like if patch, it'll treat your hot flash. Low dose vaginal cream will treat your vaginal dryness. Oral progesterone will treat your insomnia. And now you have to still do like testosterone cream for your libido. And now you're at like 5 or 6 different hormone replacement products. That sounds like a lot. So women are actually putting on multiple products in order to cover all their symptoms, and they're still only getting their estrogen levels to like 60 or 100. The upper limit, if we say it's right, is 400, right? And you're just above like 60 or 100. Women are barely, like it's like spitting into the ocean. They're barely feeling better.
So what is the correct format?
So my revolutionary or whatever, like you said at the beginning, thank you for that. Was like a product is an all-in-one. Like you can raise all 3 hormones with just one tiny amount of cream. It's like a pea-sized amount of cream.
It's a cream. Okay.
That's that you can put vaginally, and you will get systemic results, and you can get levels closer to not, sometimes we get to this 400. It really depends on how your body metabolizes it and when you get the labs. That's why we try to stay, like labs are very, very misleading. Sometimes you get a lab and your estrogen will be 600 in the morning, and then you take it again and it'll be like 50 at night, right? It's really that much variation. So you don't want to change the dose based on your lab. You can't freak out if your estrogen level is 500 and you wanted it at 400, for example. It's not helpful. What you really need to do is like, do you feel great? Are you sleeping well? Is your anxiety and irritability gone? Does your skin and hair look amazing? Or the opposite, are you bloated and have acne, and are you tired? Like we want to make sure or is everything getting better? And now you feel like vibrant and energetic and you're starting to lose weight. This is more important than the lab test. And if women were to know that they are empowered actually to have this control, that this is more like the lab tests are not like God's word, or where they're not written in law. Like we've done nothing with the lab to make it I think if women knew how little science was behind that, they would be like, oh, okay, I really actually should listen to my symptoms. Moreover, does that make sense? So the optimal amount is really working with somebody who knows, getting you on a starting dose. So like our protocol, start you on a starting dose.
Mm-hmm.
You just have to see how your body does, which I know it kind of makes people nervous because like, how do you know? And I'm like, I promise, I've been doing this for a decade. Your body will tell you, and then you'll automatically feel better within 14 days, right? Or you won't. Like it's kind of like this.
Okay.
You have to take the leap of faith. Like, does that make sense? You have to take the leap, try it, and then generally women are pretty surprised at how simple, and they don't actually feel like a different person. They feel like themselves. Does that make sense?
That's beautiful. Yeah, it does. So is your work targeted to perimenopausal women, or
We see.
let's say that you're 70, would you still want to start this treatment, or is it too late for you?
Good question. So we take anybody over the age of 21, really, because like we see women, younger women with endometriosis and polycystic ovarian syndrome and a lot of problems. We can get into why we're seeing it in such a young population, but this is really like everybody. It is not an age. It is not a period thing. If you are having a lot of problems, your hormones are likely low. We have an age cutoff of 59. This is like a self-imposed cutoff. And the reason why is because women, honestly, it's because women's will start to bleed a little bit on hormone replacement therapy. And if it's been a while, they don't necessarily like it. It's not that there's anything dangerous about it. And so a 65-year-old will bleed a little, will start bleeding again. And I always say, like, you can't have youthful levels without youthful uterus, but I'm not sure they appreciate that either. So there's something like they're kind of done with it. And so that's why we just have the cutoff age 59. But the new research, everybody out there that's over the age of 59, the research shows, we used to think there was this magical window that you had to be within 5 years of menopause. And we're finding that this is not true, that if you're 70, that you can still benefit. It helps with bone health. It helps prevent, like if you prevent from falling and breaking your bones, this is really huge. And then it prevents urinary tract infections and yeast infections and urinary incontinence and pelvic health. And like as we age, it helps with sleep and cognition and prevention of Alzheimer's. And it's really huge. So there's like a lot of benefits to be had over the age of 60. So like you just need to find the right provider that can get you started, but you should absolutely like start even over the age of 60. You just can't start online with us because we don't have being online. We have to set some
boundaries, right? Okay. Well, that's great. I'm glad I asked the question, right? Because like when I go in and I talk to my doctor, he says, "Yeah, you're 10 years into it. Why bother?" I think I love where are you going with this. Yes. Sorry, go ahead.
You're only 66.
Right. Mm-hmm.
Yeah. So like, what about the rest? Like, what about the rest of what about the next 30, 40 years?
Yeah.
No.
Yeah.
So like, people are living longer and longer and we want to be as healthy as possible. We can prevent diabetes. We can prevent heart disease, right? It's not necessarily a treatment. Like it's harder to treat heart disease than it is prevent it. So if you're healthy and you have great heart at 66, you start it, you can maintain that health for the next 20, 30, years. And so a provider that's not your OB-GYN or your primary care physician, because they don't know, would likely get you started on something that would work for you to help you sleep, right? If you're having trouble sleeping, it would help you gain some muscle as you're working out and help with that brain fog.
Right. Awesome. I'm on it. Awesome. All right. So excellent conversation, ladies. I hope you're paying attention. This is how you have a great health span and not just a lifespan. So, how does the current focus on menopause and perimenopause highlight broader issues in women's hormonal health and healthcare?
I think it's great that we're talking about menopause so much. I love it. Like it's like a lot of the recent movies and the social media, and it's getting a ton of attention, and it should. Like we absolutely need to be talking about menopause. Menopause is kind of a narrow, though. It's really women over, I don't know, the age of 50. Like if you think about really what that is. And as I mentioned, that's, I think, why the word perimenopause is coming about, because we're recognizing this entire 20-year span. And there's no difference. Like, there's only one difference between perimenopause and menopause. Otherwise, they're the same. The only difference is in menopause, the period stops. And I want women to know it is the last thing to happen. Do not wait until your period stops. It is like when you're having hot flashes and your period stops, please like do not wait until that happens. Like it's just a symptom. The period stopping doesn't mean anything like we talked about. Giving it too much power, the period. It doesn't mean that you're making hormones. So it's just a symptom, the last thing to happen. You really should be thinking about it in your 30s and 40s because you're just why? Like why would you wait? If you can feel great now, why wouldn't you feel great? If you're 45 and you're struggling, why would you wait? But the broader issue is women's health in general, that one, we have this huge gender data gap, that we have a ton of literature on testosterone in men and like 5 papers on optimal reference ranges for progesterone in women. It's not like this. Even you mentioned, during the luteal phase or whatever, progesterone's high. I even questioned this data because it was done on very old laboratory testing, radioimmunoassays, very outdated stuff that we would need the medical and scientific community to reevaluate this. Do we even really completely understand a woman's period? Let's like look at it again here. Do we have this full understanding? And then why do we have so much endometriosis, infertility, and polycystic ovarian syndrome patients in their 20s and 30s, right? This is really like a crisis that we have. We have women at prescribed antidepressants, anti-anxiety med, sleep aids. They have 4 times the amount of autoimmunity than men, right? We have a lot of health. It's like a health crisis for women. And when they go to the doctor, they're told that they're normal. They're given birth control is not an answer. Like doctors think that birth control is a treatment for everything. It's like, here, take some birth control. This is really, really scary because birth control is not a treatment for anything.
I know. And then you know what that does? It causes problems when they're ready to get pregnant. So, yes.
Yeah, because and if women knew that birth control is not hormones, it suppresses your own hormones. And then we've been always told that it's hormones. Like I even like when I was young, that's what I thought it was. Oh, I can't tolerate hormones. I didn't like birth control. No. We suppressed your hormones, and that's why you had all those symptoms. You got bloating. You got all the symptoms of perimenopause and menopause: bloating, anxiety, headaches, depression.
No period.
And no period, right? So you're like, we basically forced you into like a menopause state with the birth control, and everything, and you gained weight and had all these problems because you didn't have your hormones around. If women started thinking about it that way, oh wow, my hormones are actually really protective, and there must be a different way, for that. And birth control can function as like a short-term thing, but it shouldn't be a treatment. We're giving it to teenagers for acne. We're giving it to teenagers for heavy periods. This is like a crisis that we think this is a solution.
Yeah, because doctors are not. You're right. I mean, everybody talks about when you go to a doctor, the training is not all inclusive. Or maybe they focus on one thing, but yeah, they always hand out these pills like candy, especially for a young girl comes and she's getting every period. Oh, let's take pills. It's gonna control your period. I mean, you're having heavy bleeding. Take the pill, and it will control that. And they do that. But my daughter, I mean, I've been thinking about it because my daughter was having something, irregular period or something. I'm not quite sure, but they gave her birth control pill, and she's one of the few people that are progesterone actually makes her get blood clots. So she had it when she was pregnant because of the higher progesterone, and she got it when she took the pill. So that's another,
So, it's kind of, so to kind of clear up misconception is that birth control increases your risk for clotting because it's fake hormone and it takes away your own hormone and it's fake progestin, right? Hormone replacement therapy, which is your natural, where we're replacing progesterone and estrogen and what you naturally make, does not increase your risk for stroke. And pregnancy itself is just like a state because you're sedentary, you have more blood, you're in this like really, where your immune system is wild. And that's why those women have an increased risk for stroke. But it's not the hormones that do that. The hormones actually protect against stroke. Mm-hmm. But we tell women that, it's the hormones that causes stroke, but it's not. So like, otherwise you'd have literally every single pregnant woman stroking in the ER. And we don't. Right? We have like women are like pregnant all day long. They deliver all day long. And like stroke and pregnancy is very rare. They don't clot, right? And their progesterone gets up to 300,000 picograms per milliliter, 300,000, and they don't have a stroke and they don't clot. So women need to understand that these hormones are protecting against clotting. That's actually what they do. And so this, like the misinformation that the doctor gave you and your daughter, yes, it's true that birth control increases risk for stroke. And so what we don't inform, like there needs to be informed consent for birth control for women. Hey, I'm going to give you this birth control, but I need you to know that there's an increased risk for stroke and cancer. And they don't tell women that. They act like it's some really benign, safe thing, and it's not.
Yeah. Birth control is dangerous.
Well,
I'm seeing all the effects of it now with women that can't get pregnant and have all these issues and right, yeah, they're handing those things out like Tic Tacs. But yeah, I mean, and you've also just given me something here because my daughter is 36, so she can benefit from your program because yeah, maybe you guys need to look at her own hormones, and get her on a plan. So that's beautiful. Yes, thank you for that. All right. So excellent information on this episode, Dr. Sarah. Thank you. So let's talk now about your program. It's called Inner Balance. What services do you offer to women?
we do hormone replacement therapy online right now. So pretty much this, but it's a customized approach. So if you have endometriosis or polycystic ovarian syndrome or something hormone related that's due to most likely low estrogen and progesterone, we would treat you. And this includes perimenopause and menopause and then postpartum. So women do not have to put up with postpartum symptoms. Like this is, we used to, oh, it'll get better. We can't do anything. Or breastfeeding, or this is not true. You do not have to have OCD, anxiety, depression, insomnia, like weight gain, all this stuff, the hair loss that's going on in postpartum. We can intervene and help during that period of time. And in this young population, they can still get pregnant on the hormone replacement therapy. Like on our cream, women get pregnant all the time, actually. So it's not birth control. I want women to know that they have to be informed that if they take the hormone replacement therapy, they can still get pregnant on it. But our process is you can sign up online. We're in 40 states, soon to be 50. You have to fill out like a medical questionnaire as you get started, and then verify your ID. These are all just state laws that we follow. And then after that, we reach out to you and follow you. So we make sure that you're doing okay. We don't leave you hanging. So we're with you every step of the way. We give you a lot of information. We'll recommend supplements, sometimes your unique case. And this is where the customization comes from. We don't need to know your labs before you get started because nothing in the lab is going, as we mentioned, nothing's going to predict what your dose is. Like there's no magical lab out there. There's nothing that is going to say your perfect dose is this. You actually just have to get started on something and try it. And then we make adjustments from there. So based on how you do, we can go up or down, right? So we can make an adjustment in the treatment. And this is how you can get the personalized approach. No other company online is doing this. They just have like a one size fits all. Here's the manufactured vaginal cream that doesn't really work that well, but you can try it. And it's $30. So ours is $199, but that includes $199 a month. But that includes the treatment plus like our care. And so it's like this follow-up care and the doctor and the clinic and our experts. And then it drops to $99 a month after that for 6 months, because by 6 months, you should be on the dose that's right for you. Like hopefully by then you've gotten where you need to be. I'll raise the dose around 4 months. And then after 6 months, you need less and less clinical support. And that's why it's just $99 a month, because you're just paying for the treatment, which most of these compounded custom formulations from these pharmacies, they're cheaper out of pocket. The insurance doesn't really cover them. They don't cover all of it. So the vast majority of these are out of pocket anyway. So this is kind of what we look like in a process. We want to make it open, remove some of these barriers that women are having, finding the right specialist. If you do find the right specialist, this can cost thousands of dollars to go into a clinic. Yeah. Just to open the door and to get help.
$199 a month. Excellent, actually. That doesn't even cover one doctor visit now if you don't have insurance.
And it's cheaper than some of these fancy urine tests are like $400 or $500 just for the test, right? So you can get your 6 months first therapy, and we have a 6-month guarantee. We'll give you all your money back. You try it, you don't like it, fine. No hard feelings. Just I know that sometimes this takes time. I know that sometimes women are sort of switching from another formulation. They're on an oral progesterone pill and a patch, and they want to switch, and they need that time to adjust. Mm-hmm. And sometimes it's a 6-month journey sometimes, and that's fine. You can try it for 6 months and still get your money back. I want to make sure that right? You take the time, don't feel rushed. And this is important too in the process. and no needles, right? It's like a tiny amount of cream, as I mentioned. Like, how easy can it be? Like a little daily application. Like, you don't have to inject anything. You don't have to put a
Beautiful.
pellet in your butt, huh?
That's beautiful. Wow. Yes. Wow. Huh. Wow. You're giving us hope. You're giving us hope, Dr. Sarah. That's what you're selling, hope.
Well, I hope so. Like, as the goal is, like, I want to give women what they deserve, like what they want, and this is,
That's
hopefully.
great.
A
Great
lot of women
information.
a lot of women are in smaller towns. They don't have access to specialists too, unless you're in a big city. So this way they can feel confident that working with us, that they're going to get the answers that they want. There's no AI on the other end of our customer service. Like, we get that all the time. They're like, are you like real? Are you in a I'm like, we're people on the other side of the line. So at an balance, like you're going to get like a real expert and you're going to get your answers to your questions within 24 hours. You can meet, and then usually women can meet with me within a few days after requesting it.
Mhm.
So we love working with our clients.
Okay. Yeah. That's amazing. All right. So tell us your website and I know you're on social media. So what are your social media handles?
Yeah, so our website is www.innerbalance, INNER, balance.com. Because, estrogen and progesterone need to be in balance, right? Right. Yeah, it's great name, right?
Okay.
And social handles are Inner Balance MD and then Sarah Daccarett MD. And we have a lot of information on there too if you're still doing your research, right? So, and you can reach out to us on the website if you have a specific question about your case that you're wanting an answer to before, like while you're doing your research. But if you're wanting to know before you get started, we'll answer that for you. Yeah, and I'll send you a coupon link too or something for your listeners. But this is, yeah. So
Yeah, that would be great. That would be great. Like I've got a few clients for you already.
Mhm.
Yes. Well, listen, thank you so much for this information. I really got a lot of this conversation and I set the intention that I would get a lot of information because I know that, looking at my panel, right, I think my testosterone was okay, but zero progesterone, zero estrogen. And my doctor says, "Oh, you got to deal with it."
You don't have to deal with it. And thank you for helping me.
So,
Like, you
I
can.
mean, that is amazing, so I will definitely take you up on it and go look for a hormone specialist in my city. And get working on my next 30 years, right? I love that. Love that. So yes, great information. All right, guys. Well, listen, for all the women out there, like you said, Dr. Sarah talked about, you should start looking at your hormones when you're in your 30s. So don't wait until your period stops and you're in menopause and you fall off a cliff where everything is because that's what people talk about. I mean, we've been saying that everybody's been talking about menopause, but yes, there's a lot of stars that are out there talking about what happens to them in menopause. And so, yeah, there's a lot of conversation going on about it right now. So it's a good time to educate women and let them understand that, there's some faulty information out there regarding human, hormone replacement therapy. So I'm glad that Dr. Sarah can leave us with some information as we want to know more. We contact her company. I will have a link out on to her website and social media handles on the show notes. And you can head over to the show page, which is myhelps.us, to get a summary of this conversation if you missed something. So, yeah, I totally enjoyed this conversation and learned quite a lot for myself. And hopefully that you that are listening learned quite a lot too, because if you're a woman, you got hormones, right? It covers everybody. Nobody's exempt, right? Right. Yeah. So thanks again, Dr. Sarah, for being on the show. This was amazing. As we wrap up, any last words?
No, thank you for helping get the word out.
You're very welcome. Yes. Definitely a conversation that I benefit from as well as my listeners. So thank you guys for tuning in. If you want to, I would love for you to maybe leave some comments if you're watching this on YouTube, or if you're listening to this on iTunes. We'd love for you to rate and review the podcast as well as this conversation. Thank you for tuning in. Thank you, Dr. Sarah, for being on the show and leaving us with this important information. So thanks again for tuning in. Until next time, namaste.